From the bulge we have just behind the ear, deepening slowly, intensely, deeply towards the center. From the mastoids, deepening slowly, exhaling and towards the center. Let's continue with what I call scratching, which we can do from the center outwards and then back. It's a maneuver where we slide the skin over the underlying structures, as if we were scratching, but instead of the skin, we scratch the entire area where the cervical musculature inserts into the skull. All these muscles attach here, in what is called the occipital condyle. I insist, it's a movement as you see, like scratching. For example, we can start from the center, a bit higher or a bit lower, and make several trips because the insertion zone is not only here but also goes up a bit more. We place our fingers there and go on. We can do it on both sides at once or just on one side, using our nails. The thing is, my fingers are not sliding on the skin, so we must be careful in this area where a nerve passes through, called the Arnold nerve for those who aren't French speakers. We must be cautious because that nerve can be very sensitive. Avoid it, and then, if you feel a different kind of pain, be careful, that zone is where the nerve is. And we can go through the entire path up to the mastoids, scratching. Then, make the return journey and we can do a back and forth movement several times. From top to bottom, more in the upper region or more in a lower region. We can travel through the entire area of insertions in the back of the neck. Next, let's move on to a maneuver where we will open up the musculature, working all this musculature down to the bottom, all the trapezius muscles, the splenius muscles. For this, with good pressure, placing the head even a bit backward to keep the muscles relaxed, we open up, separate, as if we wanted to pull the muscles apart. This is done without oil or with a minimal amount of oil so that it glides just right. If it glides too much, you won't get a good effect. If it doesn't glide at all, you can burn the skin or hurt yourself, but generally, with the natural oils and moisture on our skin, it will be enough to perform this maneuver. You can move down to the lower trapezius area and the region of the upper angles of the scapula that go up. While working this area, you can also work unilaterally and then do the other side. Turning your head to the opposite side, stretching your arm downward to put all the musculature in tension and also move from the center forward. It may be a painful maneuver. Do it with moderation. Always breathe. Exhale the air. Release the pain. And loosen up. Do it on both sides. Next, we'll work on what's called the angle of the scapula, where the angular muscle of the scapula attaches. It comes from here, upwards towards the cervical area. It's a zone that can be very painful, very sensitive, but very important when dealing with shoulder problems. Tension in the shoulder area and in the lower cervical area. To work on this area, we will initially find the angle of the scapula, which is here. And there, we'll perform friction, keeping our fingers attached to the skin. And as you can see, I move back and forth. It can be very painful, so you can adjust the intensity according to your comfort. Later, we'll perform a maneuver where we'll fix our hands on the back of the vertebrae. And with the thumb that's free, we'll come from the front, working on the entire zone of the scalene muscles, and then pulling on the trapezius muscle and the angular muscle of the scapula. It's the movement you see here. To do this, as you can see, I place my 4 fingers in a counter grip. Bring my fingers here, in the area where the scalenes pass. And from there, I'll pull back and towards the hollow of the trapezius. Downwards, pulling on the angular muscles of the scapula. A bit lower, and there, we'll pull. It's a very important area to work on. Finally, even though it may not seem related to the shoulders or their tensions and the tensions in the trapezius area, the posterior area will work on 2 very important muscles. The pectoralis minor, which comes from the chest, and xiphoid, which is this one, going down towards the first 3 ribs, and the insertions of the scalene muscles that come from the front, pass under the clavicle and attach here to the first 2 ribs. Why are we going to work on these muscles? Because both of them bring the shoulders forward, the pectorals, and the head forward, the scalenes. That's why they cause this and this. If they are contracted, close towards the center, those who suffer, of course, are the muscles in the back. So we'll work a little on this area to open it up. So, on one side, we'll work on finding the coracoid process, which is like a hard ball, a bone. It's this little hollow we have here. And we'll move it up and down. We do 20 repetitions, rubbing well on the entire insertion. Then we'll do some passes from the coracoid process downwards, and with the shoulder pulled back. Pulling back to pull. Stretch the pectoral. We work deeply on the pectoral. And finally, in this area is where I mentioned that the scalene muscles attach, coming down from the neck and inserting into the first and second rib. We can perform a friction, left to right, left to right. And with that, we have completed this sequence of self-massage.